Welcome back to the program, and we'll continue our conversation with Earl Lask. Earl, thank you again. So tell me a little bit about yourself, and I read that you also experienced a little bit of these issues in your life at an early stage.
Yes, when I was 11 or 12 years old, I developed ulcerative colitis, which is when there are sores on the lining of the large bowel, which causes diarrhea, cramps, and most unpleasant. And it would come and it would go. But when I was 15, it became very bad, and I ended up in the Royal Columbian Hospital here in I grew up in New Westminster. And they performed a surgery, and that was the first of many surgeries. I spent my summer holidays going into the hospital. It was 1960, so things are quite primitive. It's 65 years ago.
Very different.
And whereas now, it's a much, people are in and out in a week, maybe even less. And I was in the hospital for 3 months because everything that could go wrong did go wrong. But as you can see, I
blessed as you are, yeah.
I am, and apparently, I have had a ostomy longer than anybody else in Canada. It's for 65 years because people don't usually start that early in life. So I've seen a lot of changes along the way, and my friend Deb Rooney and myself speak to the nurses at Douglas College each year, and from a patient's perspective, so they understand what it's like to be in the hospital, to have this happen. And one of the things that I try to emphasize is that there isn't anything I wanted to do in life that I did not do because I had an ileostomy.
So it didn't stop you, basically, to tell yourself, well, I'm less than anybody else, or I'm suffering and I'm not able to do this. So you continued as a norm in the life.
Yeah. I had the advantage of being so young that I didn't have any of the issues that older people, somewhat older people might have, such as body image, having a partner who didn't understand, and this sort of thing. And so I missed grade 11, and I went back to school, and away I went, and I went to university, and that's where I met my wife, and we're married, have a
beautiful kids.
We have a child, and so my life, it's been an inconvenience, but not a handicap in any way. And one of the things that our organization does, besides the donations, is we go to visit people in the hospital before they've had the surgery or after they've had the surgery, because they don't even know the questions to ask.
True.
And it's quite challenging for some people to deal with what's happened to them, whereas others just take it in stride and do the best they can. And I try to encourage them in saying that I'm not exceptional. I'm what happens after you get used to it, figure it out, and away you go. I was a runner all my life. I still play, I'm 80, I play golf. I walk every day, and I'm physically active, and it's really, life is as it should be for me, as I wanted it. So, I've gone through all the stages of life with an ostomy, whereas not too many people have that, either fortune or good fortune, depending on how you look at it.
I think it also may be perhaps the understanding how to cope with it. Because if person isn't willing to accept, okay, this has happened to me, I'm in the hospital, I've gone through the surgery, you accept that change in your life. And I think that to overcome that change must have been difficult for you, or was that process, how did you go through that journey? Because I know you made it so easy for me to think that it was just a process and person just went through it, easy flow. But I'm sure it must have been difficult from a medical perspective, and also to go through that change. It may not be easy for touch wood, everyone should stay healthy, but in case something does happen in their life,
Yeah.
that process must be difficult to go through as, have a...
I understand your question, and a good question, because a lot of people would wonder, how does a person manage?
Yeah.
Well, I keep going back. 65 years ago, there were no trained nurses to take care of people with an ostomy.
Yeah.
They were doing very few surgeries. In all of British Columbia, there were 75 people with an ostomy, and most were older, people who had developed rectal cancer, which it used to be for older people in their 70s, 60s, 70s, and 80s, and now it seems to be dropping down into the 50s. And so there weren't any kids.
Yeah.
So I'm in the hospital. I have full-blown peritonitis. They've decided they're going to do the surgery. They brought in I can still remember what he looked like, and he was from UBC, and they had brought in an expert, and he agreed that they would do the surgery. So he said to me, we're going to do the surgery. You're going to eliminate into a bag on your side for the rest of your life. And he was wearing a plaid green sports jacket. I can clearly remember him. And I began to cry, not a boo-hoo cry, but tears coming down. And he said to me, "Don't be such a baby." So that was the support that I had, as opposed to today, where you have trained people, you have experienced people, you have others around who can come and give support. So I had the good fortune of having wonderful parents. And that made all the difference. And my dad was a family doctor.
Wow, okay.
And so, although he had no experience with anybody with an ostomy, doctors, that's not their role. It's completely a nursing role. But I can't explain. I just carried on, and I went back to school as soon as I could, and it was like a non-issue. I can't quite explain it. I was happy to be alive, and I came very close to dying, which I did not know until 20 or 30 years later, how close to death I came. And but so I'm not a good example for coping. It's just
for what I'm hearing from you, other than just being blessed, you're in good hands, good parents who had understanding. Your father was a medical doctor himself, so good timing, best place to be, under good care. And you've just, like, your journey, as I say, even though it is a difficult journey, but you went through it so smoothly.
I
in
did.
Your words,
I didn't
right?
really.
So you didn't have any challenges.
Yeah, I really didn't, and because well, I use the phrase body waste. Well, I'm a biologist. I went through in science, and in my family, I mean, at the dinner table, you talk about all sorts of things that would be upsetting for other people. So, I mean, I sort of had a pretty good idea how the body worked and that sort of thing, and personal hygiene was just not difficult to manage. I never became depressed about it. And nobody talked about it. I have a large family, close family here. Nobody said anything. They didn't know what to say, and so I didn't have to discuss it. And I can't explain the coping part, because I never felt at any time that I was coping. I just carried on.
Thank you.